You mentioned there when you're talking about toxins and supplements, you mentioned lead, which got me thinking about part of your story where you had a heavy metal problem and you needed to detox that. So take us to what point that was in your health journey and what you did to remedy that.
Yeah, it's such a good question. The short version of that story is that at 40, I really had one focus, and that was a number on the scale. And I had told myself at like 38, I want to be in the best shape of my life when I hit 40. So sure enough, 40 came. I was like, I had worked out a ton. I had restricted food. I didn't know about fasting back then. I was actually pretty paleo. I had done a ton of supplements. Like I did everything. And I felt amazing. By 42, 43, my health had completely unraveled. And I hadn't done anything. I hadn't changed anything. I kept that lifestyle going. And what I realized is that in those first 3 years, which is very common for a lot of women, I was starting to go into this perimenopausal phase. Now, in the initial phases of perimenopause, estrogen goes up and down and up and down. Like there are drastic changes in estrogen. That roller coaster ride of estrogen triggers certain toxins to come out of your system, lead being the biggest one. So lead came out of my system and it went up into the brain because that's what it'll do is it'll go up into fatty nervous tissue, which is what the brain is. And I started to notice depression for the first time in my life, recalling words. That was crazy to me. Like I would be in the middle of a conversation. I'm like, what was I saying? Like there was literally like a whole thought would stop. I would walk into a room and not know why I walked into the room. I forgot stuff all the time. And what I realized is that this hormonal ride that I was now on was causing lead to come out of the tissues. And if you think about what menopausal women go through, there's a lot of talk about osteoporosis. Okay, well, why does a woman get osteoporosis as she goes through menopause? Well, or through that transition? Well, lead's coming out of the bone, destabilizing the bone, because it was in there, creating some stability. And so it's changing the inner matrix of the bone. So osteoporosis is a byproduct of this lead. It can be of the lead coming out, but where did that lead go? And it went up mostly into the brain. And so that's where I had to really go into some deep detoxing to deal with that.
So a lot of nuance I want to dig into within this. Where do you think that lead came from?
It's a great question too. So, the first thing is that we have tested thousands, probably hundreds of thousands by now, have heavy metal tests. Nobody has been free of lead. I have not seen anybody with a clean lead profile. I was born in 1969. Leaded gasoline, leaded paint. We didn't pull that out of many of the common things we were exposed to. I don't know if you know that there's actually some interesting studies done on learning disabilities of children that sit in classrooms that have old classrooms that have lead paint on them. So just because we look at the wall and we're like, hey, how could that come off into the air? There is an off-gassing of lead that we will breathe in, and it can be from paint, and it can go into our nervous system. So a lot of it is just the time I grew up. We don't have that as much now. The second thing, though, is it's generational. So these heavy metals, because they stay in our system, they get passed down from generation to generation. And I have done whole family heavy metal tests now, and I will tell you, you can see the lead is the highest in mom. It'll be the second highest in the firstborn. Then it's a little bit lower in the secondborn and a little bit lower in the thirdborn, and you can see the whole pattern. So when I look at my family history, mom had osteoporosis and she had thyroid problems. We haven't tested her lead because I just didn't know. It's a provoked test that I like to do, and I didn't feel like that was going to be something that I could put my 70-year-old at the time mom through. My sister, so she had those issues, thyroid and osteoporosis and chronic pain. My sister in her 50s started to get, or in late 40s, started to get thyroid problems. So we tested her lead. Her lead was one of the highest I've ever seen. And then in my early 40s, I started to get sleeping challenges, depression, memory issues, hot flashes, and my level of lead was a little less than my sister's. So it's generational and it's being passed down. And if that's the first time you're hearing that, I get that sounds crazy until you dive into it. Just go to Google Scholar and type in generational toxicity lead, and you will see the research on it.
So for you, Mindy, in your case, you waited till perimenopause. And this was interesting. I didn't know that because of the hormones at that time, you can expel lead from the bones. That's fascinating.
Yep.
But given what you know now, how would you have gone about dealing with that before it became a problem? So if you could go back to, say, 20, 30-year-old Mindy, would you do that provocation test and then do the similar protocol you did later? For people that might not know right now where they stand, who should get the testing done? It sounds like all of us are affected to some level. How does the quote-unquote average person right now who hasn't had symptoms from it determine where they're at? Should they do testing?
Yeah.
I'll let you take it
it's
from
a great
there.
question. So the first thing you can do is you could just look at patterns. So look at the patterns in your family and then look at the patterns in your life. So some of the big things that we know heavy metals affect are chronic fatigue, memory issues, mood disorders, thyroid problems, inability to lose weight. And then you also see a lot of like learning disabilities. So you can look for those patterns in family and go, we call it genetic because everybody has a thyroid problem in the family, but could there be something else in there? And that's where we start to see lead show up. To answer that one, I had reading challenges, reading comprehension challenges when I was a kid. I now know that was part of that was lead. After I had my son, my second child, I had a thyroid problem. That was lead coming out through pregnancy, because that's another time. Postpartum depression can be an influx or an outflux of this lead after pregnancy. And then I had the perimenopausal issues. So the cool thing about where I caught it at perimenopause is I corrected it. And I will tell you, my thyroid, I've never had a problem with my thyroid. And I strongly feel that's because I stopped it in my early 40s. So, but to answer your question, so I just want to kind of help people see the lifelong view of these heavy metals and where they show up. To answer your question, if I could go back to, the younger version of me, I would in my 20s, I would have tested and I would have detoxed, and I would have done that before I got pregnant. Because I see the pattern in my daughter, who's my firstborn. I don't see it as much in my son, the second child, but in the first one, I see some issues around, anxiety, trouble sleeping, and I realize, there's a toxic load there. So we've been teaching her how to detox now at 23.
And for somebody who either has testing done and realizes they have metals in their body, or they just assume to do the detox, is this something you'd want to work with somebody? Because I've heard if you're not doing it correctly, you can end up reabsorbing the metals and toxins. Talk about what somebody to do if they want to do this the right way.
Yeah, thank you for saying that, because it's not like you can just drink celery juice in the morning or decide that you're going to take some chlorella and all of a sudden now all the heavy metals out of your body. There are 3 phases to detoxing heavy metals. You got to prepare the detox organs. So that's liver support, gut support, lymph, make sure your lymph is moving, make sure you're sleeping so that you're, or at least committing to try to get some good sleep so that your brain, it will detox at night. You got to be sweating, make sure you're doing some breath work. And then, what we do, we have a program called the Thrive program where we teach this. What we do is we power people up with supplements temporarily to increase the detox organs so that they're well supported. And that can last anywhere from a month to 3 months, depending on how weak those organs are. Then you got to pull it out of the body, because you got to think of the body as like, if you're going to detox the brain, it's going to go into the body. So the body actually has to be prepared for the detox effect that you're going to try to create in the brain. So we usually spend a month or a couple months detoxing the body. And then the third phase will go to the brain and we'll detox the brain. So it can take 6 months to a year to help somebody detox properly. It's crazy the results when you're thorough and you're patient and you understand that process, how ridiculously effective that is. So to your point, it's not as simple as if somebody stands up there and they're like, take this supplement or do this chelation. You got to use binders. You have to cycle in and out. I mean, there's an art to it. And that's, we teach it, other people teach it, but my goal when I teach it is I want to teach somebody how to detox. So A, they don't need us anymore. And B, they can learn how to detox for life because the world is not getting any less toxic.
For somebody who might just have a little bit of metals or different toxins in their body, they're not at the point where it's severe, it's affecting them, but now they're aware and they want to live preventatively and also chelate out if there's a little bit of, accumulation. Is there something that people can do on their own that's more gentle if they're not in that severe case where they need to work with a practitioner? Yep. Or is it just recommended to work with a practitioner?
Oh, no, I think this is good because I always like to go, okay, what can we do today after you listen to this podcast? And I think thank you for bringing that up because the goal is not like, health shouldn't be expensive for everybody. Like we got to have some daily routines we can do that keep us moving in the right direction. That's why I love fasting. So for starters, look at your toxic load. So scan your whole environment. One of my favorite apps is called Think Dirty. And you can take Think Dirty and go around your whole house. And mostly it'll be your beauty products and just see what's in there, see what the toxic load is. You can go to the Environmental Working Group site and you can actually type in your zip code and it'll tell you what's in your water. They have lists upon lists of toxins. So your first goal when you're detoxing is stop the influx. When you go to the dentist, don't let them put, the silver fillings in your mouth. And some people may want to actually get some of them removed by a proper dentist, like a biological dentist. But let's stop the influx. Second thing you can do is open up your detox pathways. So I mentioned this before, which is sweating. Are you sweating every day? Breath work. Are you doing breath work where, like that Wim Hof breathing is phenomenal? Are you moving? Are you getting out and getting circulation going through your system? And then are you sleeping? Because at night your brain shrinks so that the cerebral spinal fluid can go up and can wash the brain every night. So are you committed to sleep? Are you getting enough deep sleep? This is why I love all the biometric wearables right now, because we can see how much deep sleep we're getting. That's the first number I look at every morning is like, how much deep sleep did I get? Because I know that's how my brain detoxes.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
But what we're doing right now is we're just having women push on through every day of the month, and that's destroying her hormones. And now you've got PCOS, you've got infertility, you have mood disorders, you have menopause, perimenopause, like